Welcome to the another video of Histopathology and Cytology Techniques Unit 2, V-2, Cytological Procedures. Smear preparation of cytological specimens. Cytological smears are prepared for microscopic examination to detect cellular abnormalities and aid in diagnosis. Specimens include sputum, urine, effusion fluids, e.g., pleural, peritoneal, pericardial. Other body fluids, e.g., cerebrospinal fluid, synovial fluid. General steps. 1. Collect the sample in a sterile container. 2. Centrifuge if necessary, especially for fluids with low cellularity. 3. Smear a drop of the sediment onto a clean glass slide. 4. Allow the smear to air dry or fix immediately depending on the staining protocol. Fine needle aspiration cytology, FNAC. A minimally invasive technique to extract cellular material from masses or organs using a fine needle. Material is spread on slides, then fixed and stained for microscopic evaluation. Staining techniques used in cytology. 1. Papanicolaou stain, PAP stain. Used for gynecological and non-gynecological specimens. Highlights cellular detail, especially nuclear features. 2. Giemsa stain. Used for hematological and cytological smears. Useful in identifying parasites, inflammatory cells, and hematological disorders. 3. Acetoarsine stain. Commonly used to visualize chromosomes. Especially useful for detecting sex chromatin, bar bodies, in buccal smears. Sex chromatin detection. Purpose: detect the presence of a bar body, indicative of a second X chromosome. Specimen: buccal mucosa smear. Stain: acetoarsine or Fulgen stain. Observation: a small, dark staining mass, bar body, at the nuclear periphery in females. Semen analysis. Used to assess male fertility potential. Includes 1. Physical examination. Volume, color, viscosity, pH. 2. Microscopic examination. Sperm count, concentration. Motility, percentage of motile sperm. Morphology, normal versus abnormal forms. Presence of other cells, e.g., pus cells, RBCs, MCQs. 1. Which of the following is not a commonly used cytological specimen? A. Sputum. B. Urine. C. Blood serum. D. Effusion fluids. Answer: C. 2. FNAC stands for A. Fine needle aspiration cytology. B. Final needle analysis cell. C. Fluid nuclei assay cytology. D. Focal node acute cell. Answer: A. 3. Which stain is most commonly used in cervical cancer screening? A. Giemsa stain. B. Acetoarsine stain. C. Gram stain. D. Papanicolaou stain. Answer: D. 4. The Giemsa stain is primarily used for detecting A. Fat globules. B. Chromosomes. C. Inflammatory cells and parasites. D. Connective tissue. Answer: C. 5. Acetoarsine stain is used to detect A. Cytoplasmic granules. B. Bar bodies. C. Bacteria. D. Mitochondria. Answer: B. 6. A bar body is found in A. Male somatic cells. B. Female somatic cells. C. Sperm cells. D. Platelets. Answer: B. 7. Which of the following specimens is used for semen analysis? A. Buccal smear. B. CSF. C. Ejaculate. D. Sputum. Answer: C. 8. One of the main purposes of semen analysis is to assess A. Blood sugar level. B. Renal function. C. Male fertility. D. Thyroid function. Answer: C. 9. What is the normal pH range for semen? A. 3.54.0. B. 5.05.5. C. 7.28.0. D. 8.59.0. Answer, C. 10. In cytology, effusion fluids include all of the following except A. Pleural fluid. B. Peritoneal fluid. C. Synovial fluid. D. Serum. Answer, D. 11. What is the first step in smear preparation? A. Drying the slide. B. Collecting the sample. C. Staining the slide. D. Observing under microscope. Answer, B. 12. Which stain is best for identifying nuclear morphology? A. Papanicolaou stain. B. Ziehl-Neelsen stain. C. Sudan 3 stain. D. Crystal violet. Answer, A. 13. What is the ideal fixative for pap smear? A. Formalin. B. Methanol. C. Glycerin. D. Distilled water. Answer, B. 14. Which of the following is centrifuged to concentrate cells before smear preparation? A. Dried blood. B. Body fluids. C. Tissue sections. D. Bone samples. Answer, B. 15. Which of the following is not a parameter in semen analysis? A. Motility. B. Morphology. C. Volume. D. Urea level. Answer, D. 16. What kind of smear is prepared in FNAC? A. Frozen. B. Wet mount. C. Air-dried or alcohol-fixed. D. Paraffin embedded. Answer, C. 17. Which cell feature is most important in pap smear analysis? A. Cell size. B. Nucleus and chromatin pattern. C. Cytoplasmic vacuoles. D. Cell color. Answer, B. 18. Which test uses buccal smears for analysis? A. Semen analysis. B. Sex chromatin detection. C. Malaria test. D. Urine culture. Answer, B. 19. Which of the following is a common use of Giemsa stain in cytology? A. Identifying fungal hyphae. B. Detecting parasites in blood smears. C. Measuring hormone levels. D. Detecting urea crystals. Answer, B. 20. Which fluid is typically collected for cytological study of meningitis? A. Synovial fluid. B. CSF, cerebrospinal fluid. C. Sputum. D. Bile. Answer, B.